First of all, it's of course something we've not been trained at, but it's becoming more important because our patients are valuing not only health but also how much it costs. Our healthcare systems are increasingly strained, so we have a certain responsibility in performing cost-effective interventions. And overall, I think this whole display of what our interventions are worth and why they are relevant also in the long run with regards to both benefits and costs, I think that's something dentists need to understand. The rewards in all these kind of analysis is to understand a bit better the factors driving our decision and their impact. Most of these analyses don't yield clear-cut results. It's not like we afterwards often know what we should do, but we can make informed choices. We can say, okay, if I do this, I have that kind of benefit, I have maybe that kind of risk. On the other hand, I have these potential costs, so we can make more informed choices and decisions. I think that's the main aspect of health economics in dentistry. So we've shown in numerous papers that retaining teeth is worthwhile. If we retain teeth, we save money later on for reinterventions like implants, like dentures or whatsoever. And saving the pulp, maintaining pulp vitality is a crucial step in saving teeth at the end. So there's no doubt that vital pulp therapy is cost effective in most teeth. Of course, there are difficult cases where we need to put a lot of effort in, but I would say for 95% of the teeth, we should try to maintain the pulp vitality if it allows clinically, so if there's no pulpitis. So what is important, I think, to understand from the data we are seeing, and that's something which we have all over health economics and dentistry, it's usually not the materials which drive the cost of what we do, at least in high-income countries. It's not the composite, it's not the Biodentine, it's not maybe MTA or these kind of... They are relevant, yes, but if I compare the costs against what our time in office, of me, of my staff, of the building, of all the equipment costs, that's much, much, much more relevant for the overall cost estimation. So we should rather focus on how can we do the best treatment in maybe 10-15 minutes less than focusing on the last euro or US dollar we can save on the material. I don't know if it's easy, maybe it's not easy, but we nevertheless need to do it because we want to make informed choices for our practice, for our patients. And if I calculate it down in a table, and it's not that difficult, that table, then I see it. And then hopefully it's not psychologics any longer, but mathematics. The role of Biodentine is that it's a good and clinically proven material. And if we look into the evidence base, it's quite convincing that this material works, both from a biological aspect. There are lots of histobiological studies showing how it works, what it does biologically, but also clinically. And this clinical, that's important for me as a clinician. So when I talk to my patients about materials, that's exactly what I mentioned, and we know that it works. Well, when my patients are in that situation, what I usually do is I try to explain to them the options they have. I tell them this is what we can do. We can maintain pulp vitality or at least try it. It's not a given, it's not certain, there are risks involved. Or we can go for, let's say, the more invasive option, the root canal treatment, which is maybe a bit more certain, a bit more predictable, but also much more invasive, and by the way, it's also more costly. And I've never ever had a single patient saying, okay, I go with the root canal treatment.